The webinar will begin soon. Please stand by. Good afternoon, everyone. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on November 3rd, 2021. Next slide. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2021/november.html. Next slide. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is OneHealth2021. To receive free CE for today's webcast, complete the evaluation at cdc.gov/tceonline by December 6th, 2021. A captioned video of today's webinar will be posted at cdc.gov/onehealth/2021/november.html within 30 days. To receive free CE for the web on demand video of today's webinar, complete the evaluation at cdc.gov/tceonline by December 7th, 2023. Next slide. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of the One Health Office, will share some news and updates. You may begin when you're ready.
Thank you, Laura, and greetings, everyone. Happy One Health Day. We appreciate you joining today's ZOHU call. Today on One Health Day, we recognize the power of collaboration. We're stronger working together to achieve optimal health outcomes, recognizing the interconnection between people, animals, plants, and our shared environment. When we protect one, we protect all. We encourage you to visit CDC's One Health Day webpage for resources and graphics you can use to promote One Health Day today, as well as promoting One Health every day. You can also join us in celebrating One Health Day by following us on social media and sharing One Health messages and your own One Health work. Next slide, please. Before our presentations get started, I'd like to share a few updates and highlights with you all. You can find these in today's ZOHU Call email newsletter as usual. If you're not yet subscribed to the ZOHU newsletter, use the link at the top of the main ZOHU Call webpage to subscribe and spread the word to your colleagues. Our response to the COVID-19 pandemic continues to evolve. Please check CDC's website for the latest guidance and resources, including information about keeping people as well as animals safe and healthy. Our next One Health Partners COVID-19 webinar will take place on Tuesday, December 7th at 2 o'clock Eastern Time. During this webinar, we provide news, key updates, guidance, and resources for our One Health partners on COVID-19. Just email us at onehealth@cdc.gov if you want to receive updates and information on how to join this webinar. Next slide. There's no evidence that animals are playing a significant role in spreading COVID-19 to people, but we continue to see animals reported with SARS-CoV-2, including most recently white-tailed deer. In the United States, there are 297 individual animals that have been confirmed with SARS-CoV-2, including cats, dogs, ferrets, large cats in zoos and sanctuaries, a few other zoo species, otters, gorillas, white-tailed deer, and mink. There have been 17 mink farms impacted by SARS-CoV-2 in the United States to date. The latest animal case numbers in the US are available on the USDA APHIS website, and guidance for pet owners, mink farmers, veterinarians, and many others are available on CDC's website. Next slide. We've shared 3 recent publications about climate change and the 2019 summary report on the One Health Harmful Algal Bloom System, or OHABs. Next slide. And we've shared 2 new articles about SARS-CoV-2 in pets. Next, please. Some new announcements of interest include CDC lab testing confirms a cause of a amyloidosis outbreak, and the recall of LeadCare blood lead tests due to the risk of falsely low results is a couple of announcements to follow. Web resources to note include CDC Safe Water Program Improvement e-learning series and resources for One Health Day. Next slide. To flag upcoming events, US Antibiotic Awareness Week is November 18th through 24th, and we'll hear a presentation today about companion animals and antimicrobial resistance. Next slide. And finally, there are 3 new salmonella outbreaks to highlight, one linked to salami sticks, one to seafood, and one to onions. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past US outbreaks of zoonotic diseases. Our next ZOHU call is going to take place on December 1st. So please continue emailing topic suggestions and ideas for presentations, or even volunteer to present. You can share news from your organization that you'd like for us to share as well. Just email zohucall@cdc.gov. We appreciate your help in spreading the word about the ZOHU call by sharing the website link with your colleagues from different disciplines and sectors, and letting them know about the live webinars, free continuing education, and video recordings of past webinars that people can watch anytime 24/7. And now I will turn the call back over to Laura. Thanks again, everyone.
Thank you. Next slide, please. You can submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You can also email questions to today's presenters. We've included their email addresses on this slide, on the ZOHU call webpage for today's webinar, and in today's email newsletter. Next slide. Our first presentation, Giardiasis Outbreaks in the United States, 2012 to 2017, is by Dr. Erin E. Connors. Please begin when you're ready.
Hey, thanks for the opportunity to speak today. So I'll be providing a general overview of giardiasis in the United States, as well as sharing results from a recent MMWR on what we learned about outbreaks of giardiasis between 2012 and 2017. Next slide. Giardiasis is a nationally notifiable gastrointestinal illness caused by the parasite Giardia, shown here. It's estimated that approximately 1.1 million giardiasis cases occur annually in the United States. Next slide. Giardia duodenalis, formerly called G. lambia or Giardia intestinalis, is a single-celled flagellated protozoan parasite. Giardia is the most reported parasitic enteric infection in the US, and it's also the most common cause of traveler's diarrhea lasting for more than 2 weeks. Most cases in the US are believed to be domestically acquired. Next slide. This picture shows the transmission and life cycle of Giardia. A person can become infected with Giardia after ingesting infectious cysts, which are passed in the feces of an infected person or animal. And there's a low infectious dose. It can take as little as 10 cysts to cause an infection. Once infected, a person can excrete 10 to the 8th and to 10 to the 9th cysts a day. So one person who's infected can be responsible for a lot of illnesses if their feces contaminates a water or food source. And these Giardia cysts are pretty hardy. They can survive several months in cold water or soil and move passively through the environment. They're moderately chlorine tolerant. And people who are infected who can continue to shed cysts even after they no longer have diarrhea, sometimes for months. Next slide. So half of Giardia infections are symptomatic. The incubation period for illness ranges from 7 to 21 days with a median of 7 days. And the illness caused by Giardia is giardiasis, which is characterized by acute symptoms that might include diarrhea, characterized by greasy stools that float, bloating, stomach or abdominal cramps, upset stomach, nausea, anorexia, dehydration, gradually increasing fatigue. Less commonly, people may have fever, vomiting, itchy skin, hives, or swelling of the eyes and joints. By all accounts, it's a really unpleasant illness. Next slide. So symptoms can last 2 to 6 weeks, resolve and return later. There's also evidence of long-term health consequences, including irritable bowel syndrome, reactive arthritis, and recurring diarrhea. In children, in more serious cases, there can be issues with growth and development and malnutrition. Next slide. The gold standard for diagnosing giardiasis is microscopy with direct fluorescent antibody testing. Giardia cysts or trophozoites are not consistently seen in the stools of infected patients, so it's recommended for increased diagnostic sensitivity. At least 3 stool specimens should be examined over the course of several days. This photo here is of Giardia cysts, those large ones. Those little ones there are crypto, and both are labeled with immunofluorescent antibodies. Other diagnostic techniques include rapid immunochromatic cartridge assays, enzyme immunoassay kits, and microscopy with trichrome staining. Molecular techniques such as PCR can be used to identify the genotypes and subtypes of Giardia species. Molecular assays for genotype and subtypes are needed to fully understand transmission dynamics, and yet these assays are currently not commonly performed outside research studies. Next slide. So while most mammals, including cats, dogs, deer, and beavers, shown here, can host Giardia, their role in infecting humans or contaminating the environment with human pathogenic Giardia is unclear. Next slide. It's believed that the risk of humans acquiring Giardia infection from cats or dogs is small. The Giardia species that are pathogenic to humans usually differ from those that are pathogenic in dogs and cats. This slide shows that Giardia duodenalis can be subdivided based on molecular analysis into what are known as different genetic assemblages, labeled A through H. And then some of these can be further classified into A1, A2, or A3. And each assemblage is capable of infecting certain species, and some are more commonly seen than others. Our understanding of the zoonotic potential is evolving as we use these newer molecular tools to understand disease. Next slide. Now I'd like to review what we know of the burden and epidemiology of giardiasis based on what is reported to CDC. First, individual cases of giardiasis are reported by public health jurisdictions through the National Notifiable Diseases Surveillance System. Next slide, please. You may recall I mentioned the estimated number of giardiasis cases in the US per year is 1.1 million. However, only about 15,000 of these are reported to CDC each year. So we are a bit blind in terms of epidemiology of disease in the US. Next slide. Giardiasis is geographically widespread across the United States. Although incidence rates appear to be consistently higher in the northern states, it's unclear whether these differences in incidence reflect differences in risk factors, modes of transmission, magnitude of outbreaks, or simply the capacity or requirements to detect, investigate, and report cases. Next slide. Here's a graph of the incidence of giardiasis over time. Since 2011, the incidence of reported giardiasis cases has remained below 7 cases per 100,000. Next slide. Now to share the most recent published data we have on outbreaks of giardiasis in the US. Next slide. Outbreaks are reported to CDC through the National Outbreak Reporting System, or NORS. And here's a link and a snapshot to the online NORS dashboard. Here you can access all the conditions reporting to NORS by transmission modes, years, settings, and other variables. Data are available to view in the map and graphs provided on the dashboard or available to download into Excel. So I recommend you check it out. They are published as data are cleaned and become available, and gives you a snapshot and way to manipulate the data yourself without waiting for an MMWR to come out. Next slide. So from a recent analysis, between 2012 and 2017, 26 states reported 111 giardiasis outbreaks. Pennsylvania reported the most at 44, followed by Minnesota with 11, and other reporting states had fewer than 10 outbreaks reported. However, as I mentioned with case reporting, this may reflect jurisdictional reporting requirements, priority, and capacity rather than true burden of outbreaks. Next slide. There were 760 cases associated with the 111 outbreaks. There were slightly more male cases than female cases. 6% of cases had a reported ER visit and 4% were hospitalized. Fortunately, there were no deaths reported. Next slide, please. Since Giardia can spread through multiple transmission modes, including person to person or through contaminated water, food, surfaces, or objects, it can be really challenging to determine a single transmission mode during outbreak investigations. So in 43% of outbreaks, there was not a single transmission source identified. Among modes that could be identified, 26% were waterborne, 25% were person to person, and only 5% were foodborne. Next slide. Among reported waterborne outbreaks of giardiasis, more than half were associated with tap water systems and recreational water, both treated and untreated, followed by using outdoor fresh water as a drinking source and other. Next slide. The top 3 waterborne outbreak settings were outdoor areas such as parks or forests, followed by private residences and camps or cabins. Next slide. Among person-to-person outbreaks, the most common setting was private homes, followed by child care facilities, and less frequently among schools, colleges, or universities. Slide. Of the 6 foodborne outbreaks, half were associated with raw oysters, the other with unpasteurized milk, mixed green salad, and unknown. Next slide. There were no outbreaks attributable to animal contact from 2011 to 2017. However, using NORS dashboard data, looking at just 2018, wasn't part of the MMWR, but there were 2 additional outbreaks attributable to animals in 2018, 1 attributed to cattle, 1 to goats. Next slide. Across all the transmission modes, private residences were the single most common setting of giardiasis outbreaks. Outbreaks in private residences included outbreaks that could have been caused by household members being exposed to the same source, such as a contaminated well, as well as households where a member was exposed to Giardia outside the home, such as drinking untreated water while hiking, becoming infected, and then spreading Giardia among household members. Next slide. So although, as I mentioned, Giardia cysts are pretty hardy and abundant during infection, there are easy ways to prevent transmission. First, wash your hands with soap and water, particularly before eating and preparing food, caring for someone who is sick, or touching animals, animal waste, or animal environments. Because this is a fecal-oral disease, pay attention to washing after using the toilet, changing diapers, or cleaning up after a child who's used the bathroom, as well as use a barrier during oral anal sex. Next slide, please. For protection against waterborne transmission, try not to swallow water while swimming. Don't drink untreated water from outdoor sources. And if you're ever unsure whether water is safe to drink, drink bottled water, disinfect water by heating to a roiling boil for a minute, or use a filter specifically certified for cyst and oocyte reduction. Private wells should be tested once a year to monitor for water quality. And if you are already sick, to prevent the spread of disease, don't swim with diarrhea or while you have diarrhea or in the 2 weeks following a bout of diarrhea. Next slide. So one thing I want to emphasize is that we definitely have a lot more to learn about Giardia. There's a lack of widespread resources for investigating and reporting disease. The current surveillance systems are very human focused, and likely there are many cases and outbreaks not investigated at all, and certainly not investigated using a One Health approach. Embracing a One Health approach, as well as utilizing newer molecular techniques, can really help further our understanding of this zoonotic disease. Next slide. And I'd just like to end by sharing resources available through CDC, including our newly revamped Giardia website. I'm happy to answer questions at the end after all the presentations. Thank you.
Thank you. Next slide. Our next presentation, Insects Unlikely to Transmit SARS-CoV-2, is by Dr. Gabriel Hamer and Dr. Christopher Rowney. Please begin when you're ready.
Yep, thanks for the chance to be here and present some of our work. I'm going to start off with some introductory slides on this concept of how arthropods are potentially involved in SARS-CoV-2. And then Dr. Chris Rowney will cover some of the slides on the project we did. Next slide. So first, I want to start off describing the ways in which arthropods can transmit an infectious agent. There's two general categories of how this can happen. One is referred to as biological, and the other is mechanical. So for biological transmission, and in the case of viruses, that is where the agent or the virus can actually propagate or replicate inside of the arthropod and ultimately reaching the salivary glands. And that's how transmission then occurs through saliva. So that's certainly how Culex mosquitoes transmits West Nile, Aedes aegypti transmits dengue, et cetera. And then there's mechanical transmission, which would be where propagation of the agent in the arthropod doesn't need to happen. It's more based on contaminated mouth parts or body surfaces. So certainly Musca domestica, the housefly, is known to be a mechanical vector of bacteria such as Shigella, but also viruses, including a past report of transmission of turkey coronaviruses. Next slide. So this image on the right is showing this concept of biological transmission, where a blood meal containing virus is ingested. That virus enters the midgut, disseminates through the midgut, throughout the mosquito, ultimately in the salivary glands, and then on a future blood feeding event, that's when a mosquito or other arthropod could transmit an agent. So for SARS-CoV-2, there's actually a number of barriers or challenges really preventing this form of transmission. The first one is that when a vertebrate, like a human or animal, are infected with SARS-CoV-2, it's not really known to produce a viremia. So we're referring to the amount of virus in the blood. And in particular, it would need to be an infectious level of viremia to be able to infect a blood-feeding arthropod. So another barrier is that when researchers in the lab infect different cell lines with SARS-CoV-2, insect cells, such as mosquito or biting fly cell lines, are not known to allow replication. So if that virus cannot replicate in the cell lines, that also is somewhat of a proxy for implying that it's not able to replicate inside of the live arthropod as well. So then finally, there have been a number of studies that have artificially, through a blood meal, provided infectious blood. So through an artificial membrane, they've provided blood containing SARS-CoV-2, and both in mosquitoes and biting flies, they have seen the ability to recover virus for a short period of time, but there's not indication that that virus is replicating or definitely not being transmitted. So overall, these studies collectively conclude that this risk of biological transmission is low or even potentially absent at this point. Next slide. So then there's mechanical transmission. So this one is certainly more plausible. We know that SARS-CoV-2 can remain infectious in droplets or in surfaces for hours or maybe even days. And also even SARS-CoV-2 RNA can be recovered from feces of both humans and animals. And there's a lot of flies, including non-biting flies in the domestic environment, and that sometimes they're referred to as fill flies, things like house flies, blowflies, flesh flies, etc. They like to come into contact with a lot of different surfaces that potentially could contain virus. Next slide. So this is the group at the USDA. They published this earlier this year. This is the Arthropod-Borne Animal Disease Research Unit in Manhattan, Kansas. So they did a very important study. They wanted to evaluate this concept of mechanical transmission of SARS-CoV-2 by houseflies. So they did this all in an arthropod containment level 3. They took a colony of houseflies. They took specimens, allowed them to have exposure to a substrate containing infectious SARS-CoV-2. They did demonstrate acquisition. So they showed that these houseflies, after exposure to that surface or substrate, they did retain viral RNA and including infectious virus for up to 24 hours post-exposure. And then they did what they referred to as a transmission study. They allowed flies to come into contact with the infected substrate. And then they took those exposed flies, moved them to a new container with a virus-free substrate. And in that situation, they did see the ability of SARS-CoV-2 viral RNA to be transferred to that virus-free substrate, but they did not recover infectious virus from the virus-free substrate. So the authors concluded that flies most likely do not play a significant role in transmission of SARS-CoV-2 through this mechanical transmission route. However, the ability of these houseflies to harbor SARS-CoV-2 viral RNA offers the potential for xenosurveillance. Next slide. So we all saw that as COVID-19 emerged, there was a lot of unique and novel platforms for surveillance that were being developed, one of which was the ability to recover viral RNA from wastewater to track when and where transmission is occurring in communities. And so this concept of xenosurveillance is similar. It would be an arthropod that would either take a blood meal or come into contact with contaminated surfaces, and then using various molecular or next generation sequencing approaches, detecting a diverse array of pathogens, even some pathogens where those arthropods might not even be involved in the actual transmission. They're just a sentinel. They're just picking up the fact that the agent is present. Next slide. So I'll let Dr. Chris Roundy now take over to describe some of the work we did in our past project.
Thank you, Gabe. So with that context in mind, we started a study last summer with two main research objectives. A, determine if there was any possibility of mechanical transmission of SARS-CoV-2 by insects in the homes of human cases. And then also to explore using those insects as a xenosurveillance tool, whether or not they are acting as mechanical vectors, see if we can use them for heightened surveillance of SARS-CoV-2. This was partnered with a pet study that we were running at the time. So that bottom picture on the left, you can see our field team sampling a pet from a human COVID case. So homes that enrolled in that study, we also asked them if they would like to participate in the fly surveillance study and deployed those sticky traps to their homes. Next slide, please. So the overall study design is when cases were contacted by their local health department for case investigation, they were asked if they would like to enroll in our study. Between 1 and 3 sticky traps were then deployed to their homes and picked up about a week later. Some homes also received liquid baited trap as an alternative means of surveillance. After collection, the insects were individually morphologically identified, pooled for homogenization, and then RNA extraction and qPCR in order to detect the viral RDRP and E genes. With the liquid traps, we went through an additional step of RNA concentration to make sure that we were getting as sensitive as possible of detection from those traps. So for liquid traps, we collected the liquid from them and then also rinsed any flies that were collected, and then that liquid was processed the same way. Next slide, please. So looking into the collection results from our indoor sticky traps, down that left side, you can see which trap type we used. So all three of these traps are commercially available sticky fly traps that were provided free of charge by those companies, thankfully. And then along the top, you can see a breakdown of taxa that were collected by each trap type. So that first taxa, Blatodia, is actually not a fly, that's roaches. We did not anticipate surveillance of roaches in these homes. However, some of the traps came back with roaches on them, so we included them in our study. Some of the other highlights from the indoor traps include the filth flies that Gabe mentioned in the beginning. Blowflies, Drosophilidae includes our fruit flies. We even had some Sarcophagidae, which are flesh flies, on these indoor traps. In terms of trap performance, that trap along the top, the EZ trap, well outperformed the other two traps that we were using. And on the indoor traps, there was an average of 9.4 flies collected per trap day. And that ended up being an average of 1.6 unique taxa per trap. Next slide, please. Looking at our outdoor sticky trap results, these traps being deployed outdoors collected far more flies as we expected. We caught far more of those filth flies, the blowflies, and the flesh flies specifically were greatly increased. In terms of trap performance, we again saw that the EZ trap collected far more than the others in this setting as well. Next slide, please. In terms of our viral detection results, we in total collected 133 traps from 44 homes, which was over 1,300 individual flies. This does not include the 28 liquid traps that we tested. However, none of our fly pools tested positive for SARS-CoV-2. This was a little bit surprising given that these houses did have active human and sometimes animal cases at the time. So we took blowflies from a colony on campus, took them into our BSL-3, intentionally exposed them to dilute SARS-CoV-2, testing our pipeline to confirm that it worked. And on the pictures down there at the bottom, the right-hand side, you can see an example of one of our liquid fly traps. And on the left side is that EZ trap that was our best performing trap that gave us plenty of samples to work with. Next slide, please. So our overall conclusions, it seems that biological transmission of SARS-CoV-2 by arthropods is extremely unlikely. Furthermore, mechanical transmission is not likely to play a significant role in transmission. In our study specifically, we detected no viral RNA from flies or roaches in the homes of human or animal SARS-CoV-2 cases. Next slide, please. However, a recent study out of a hospital in Iran where they actively sampled flies in a hospital setting, they did detect SARS-CoV-2 RNA from their samples. This is a hospital setting. There is probably much more viral RNA in these environments, and their active sampling method meant that there was no time for the RNA to degrade during collection or transportation. These flies were tested while they were still alive. And so it seems that in this very high risk setting, flies may be able to become contaminated by viral RNA. However, there is no evidence that in more casual settings, such as in the home of cases, those play any role. Unfortunately, that means that we can also not use them as a xenosurveillance tool. Next slide, please. And then a quick acknowledgements to all of our partners for this study, other labs here at A&M, our USDA and CDC partners, as well as the local health department that we worked with that made this study possible. And then lastly, the companies that provided their traps for use in this study. I look forward to your questions at the end. Thank you.
Thank you. Next slide, please. Our final presentation, Companion Animals and Antimicrobial Resistance, Lessons Learned from Conversations with Owners and Breeders, is by Carrie Krug. Please begin when you're ready.
All right, thank you. Good afternoon. My name is Carrie Krug, and I work on a team here at CDC that investigates multi-state outbreaks of enteric zoonoses. In addition to our routine surveillance work, I also help to coordinate projects in the One Health space, which aim to characterize and ultimately prevent the development of antimicrobial resistance through collaborations with a variety of partners. And I'm here today to discuss one such project. Next slide. As many of you are likely aware, substantial attention and resources have been dedicated to understanding food and food animals as it pertains to transmission of antimicrobial resistant bacteria. However, comparatively little attention has been dedicated to the animals we spend the most time with, companion animals, specifically dogs and cats. Next slide. To address this, we partnered with Rescue Agency to obtain insights regarding knowledge, beliefs, and practices around antimicrobial resistance among companion animal owners and breeders, and to understand the messages that measures that these groups are taking to keep their animals healthy. We set out to explore the types of messages that might motivate judicious use of antibiotics to ultimately slow the development of antibiotic resistance, as well as to understand how this information might motivate owners and breeders to keep themselves, their families, and their pets healthy. Next slide. To begin, I'll share some insights gained from our conversations with companion animal owners. Next. Rescue was able to conduct 6 in-depth interviews with companion animal owners in early 2021. And here you can see some basic demographic information for those interviewed. All participants were self-reported dog owners, and all had reported past use of antibiotics for their pets. While this is, of course, a small sample size and these findings may not be generalizable to pet owners at large, we gained many valuable insights that will inform future work. Next slide. When asked about a range of risk behaviors relating to pet ownership, we were able to get a sense of what people are already doing to prevent illness in their pets, what things they are not open to changing, and then those that land somewhere in the middle. What we saw was that most people are already consistently doing things like washing their hands after handling waste, taking their pets for regular checkups, and only obtaining antibiotics from their vets and only using antibiotics in response to an infection, not for prevention. By contrast, on the right, people were less likely to take measures like washing their hands every time after touching their pets and really weren't open to changing these behaviors. However, in the middle here, responses were less consistent when it came to washing hands after handling pet food, avoiding raw pet food. They're not always giving the full course of antibiotics or disposing of leftover drugs. And some owners are inclined to question their vets when informed that antibiotics are not needed. And I'll go into each of these middle items more in depth, starting with the last one about trusting your vet. Next slide. It was found that, especially among owners with higher levels of attachment to their pets, there was some questioning of their veterinarian's recommendations. Some of these participants felt that they know their pet best, and if their vet didn't prescribe antibiotics, they may just go out and seek a second opinion until they get an answer they're satisfied with. For example, taking a look at the quote on the right, I asked the vet and he was very dismissive. And I can see pus around her wound. This doesn't look right. She was lethargic. This person added, a normal person wouldn't know that she was lethargic, but I see her every day and I know what she's like. Just demonstrating that this person felt inclined to question their vet's advice. Next slide. Also looking at some of the higher attachment owners, there was some reported misuse of antibiotics, primarily by not giving the full course of antibiotics or not disposing of the leftover drugs. Some owners were concerned about over-medicating their pet and that giving the full course of antibiotics may lead to this. For example, looking at this quote on the top right, they wanted her to be on it for 14 days, which seemed a little bizarre. I thought it was a little bit of an overkill. So in this case, we can see that this person didn't consult their veterinarian. They just made the call themselves and discontinued the course of antibiotics prematurely. Next slide. Another interesting item that came out of these conversations was that there are definite knowledge gaps around raw food. It became clear that many pet owners were simply not clear on what qualifies as raw food. When asked, some thought that raw food could include raw fruit or only raw fish. And some said that they definitely don't feed their pet raw food, but we're not counting like scraps of leftover meat that they would sneak into their dog's food while cooking. Next slide. And in talking about antimicrobial resistance in general, it became clear that people were not very clear on how infections can pass from their pets to humans. And some flat out didn't want to acknowledge this possibility. Everyone interviewed believed that they had personally never gotten sick from their pets, and many viewed this as highly unlikely to happen in their own homes. They also spoke about how they're unlikely to take actions to prevent transmission of disease from pets to humans. Next slide. And to summarize a few key themes gleaned from these interviews. Next. Owners interviewed who had higher levels of attachment to their pets were more likely to question the advice of their veterinarian and had more self-reported misuse of antibiotics. Most owners were not very concerned about getting sick from their pets and not particularly motivated to changing risk behaviors that could limit that possibility. Most participants were unclear on what constituted raw food, and some believed it was a healthy option for their pet. And lastly, although most participants understood the concept of animal to human transmission, most felt that it was highly unlikely to happen in their homes and had in fact never happened to them personally. Next slide. Next, I'll share some insights from interviews with dog breeders. Next slide. Good. Methodology was similar to the interviews with owners. In this case, Rescue was able to speak with 8 dog breeders with demographic information shown here. Of note, participants represented a variety of breeders, including USDA licensed breeders, show breeders, as well as small scale or non-licensed breeders. Interestingly, all participants reported some type of misuse of antibiotics. Next slide. There were some differences between what we saw with companion animal owners versus breeders. Some behaviors were fairly consistent across the board among breeders, such as keeping up to date on vaccines and checkups, sanitizing the animal's environment, isolating sick dogs, and always giving the full course of antibiotics. Responses were mixed regarding use of antibiotics for prevention, disposing of extra drugs, and only obtaining antibiotics from a vet. And it was found that relatively few breeders avoid including raw food in their dogs' diets. Next slide. While there was quite a variety in responses and reported behaviors from breeders that Rescue spoke with, one thing that was quickly apparent was that most breeders believe they are safe from infection. There was a sense that they are operating in something of a bubble, meaning so long as their dogs stayed on their property and didn't interact with other dogs, they were safe from infection. There didn't seem to be much awareness that the things that they bring into their homes, such as pet food, raw food, treats, etc., could be contributing to illness in their dogs. Next slide. Taking this quote as an example, my dogs are super healthy for the most part. I don't really let them out of my yard unless it's going to the vet, as well as I don't take them to dog parks and not to anybody else's house that has dogs. I don't want to risk that. Next slide. We saw a trend among breeders in that they oftentimes will hand select veterinarians that they want to work with and those that value the expertise of the breeder. For example, this quote on the bottom, that the veterinarians that are more breeder focused have more respect for the breeders and have more respect for the breeder's knowledge. Adding that pet-centered vets seem to want to encourage you to spay or neuter your dog and some are downright hostile towards breeders. It's clear that many breeders make the distinction between breeder-friendly vets and pet owner-centered vets and are inclined to seek out the former. Next slide. It was also found that breeders tend to encourage experimentation when it comes to caring for and raising their specific breeds. And this may include incorporating raw food diets, using antibiotics as prophylaxis, and other behaviors that may be contributing to antimicrobial resistant infections in dogs. Next slide. We also saw that it was fairly common for breeders to store antibiotics for future use. This was especially true when it comes to common infections that crop up time and time again in their breeds. And interestingly, there was a belief that their breeds may be especially susceptible to certain infections based on their past experiences, leading them to stockpile antibiotics for when that occurs. I found this quote on the right somewhat concerning, where the breeder says, "My veterinarian usually recommends that I keep it on hand," which links back to what we saw regarding seeking out veterinarians that are more likely to cater to their needs as a breeder. Next slide. Many of these breeders also reported using antibiotics for prevention, most commonly to prevent pyometra, which is an infection of the uterus. Another somewhat concerning quote on the bottom here, this person stated, "Against my veterinarian's advice, I do it every heat cycle." She goes on to say, "Veterinarians are doing something not normal. You're encouraging a female to go into heat by giving them suppository. That's no different than me using antibiotics once or twice a year on a female to prevent pyometra." And this person is a good example of a breeder having a very collaborative relationship with their vet and feeling empowered to push back on or ignore the advice of their veterinarian. Next slide. While there was at times a hesitancy among the breeders interviewed to discuss their own antibiotic use behaviors, several participants described an awareness of antibiotic misuse in the industry and that it is common in some breeder networks. For example, this top quote, "There's a website you can go to for certain things. They're for other things than dogs, but people are using them on dogs. I ordered something for a horse. Horse and dog medicines are very similar." And looking at the quote below, "There's an online dogs and cat pharmacy and they ship it to me." They go on to say they're aware of another online pharmacy that requires a veterinarian's prescription, where the dog and cat pharmacy doesn't require one. And so I get my cephalexin through them. So some really interesting findings here on where breeders are going to obtain these antibiotics, primarily online, it would seem, just highlighting an issue to be further explored by CDC and its regulatory partners. Next slide. Similar to companion animal owners, breeders often believe raw food is healthy. This is actually more common in breeders than owners, which highlights an opportunity for stronger, clearer communications on this topic to educate breeders on the risks of incorporating a raw food diet into their practices. Next slide. It was found that awareness and understanding of antimicrobial resistance was generally higher among breeders when compared to pet owners, though we did still see a range of understanding among those interviewed. Next. Of those breeders with a more mixed understanding of antimicrobial resistance, there was the perception that antimicrobial resistance is a characteristic of the dog itself and not a characteristic of the bacteria. Some breeders expressed the idea that if I don't give my dog too many antibiotics, that dog won't become resistant to the drugs. So again, highlighting another knowledge gap and opportunity for further research and messaging. Next slide. And to summarize some key themes from interviews with dog breeders. Next slide. Breeders interviewed often will seek out and select veterinarians who respect their expertise as a breeder, and at times may feel inclined to go against the advice of a vet if it doesn't align with their view or experience. Many breeders believe raw food is a healthy addition to their dogs' diets, and some report stockpiling antibiotics for future use, as well as using antibiotics for prevention. Among those interviewed, there's a sense that misuse of antibiotics is common in this industry. Next slide. And taking both sets of interviews into account, while again noting the small sample size of those interviewed, many valuable insights were gained regarding antibiotic use, raw food diets, and interactions with veterinarians from both pet owners and dog breeders. While this is an exciting starting point to characterize this issue, more information is needed to understand motivators and deterrents for antibiotic use among dog breeders, and more work could be done to better define raw pet food and what types of raw diets are common in this industry. To further explore this topic, CDC has focus groups planned to inform the development of communication materials for dog breeders to further educate on these topics. Next slide. And I just want to take a quick moment to thank our many collaborators at Rescue Agency, Cat Media, and within CDC that made this work possible. And here you have some contact information for myself and my team, as well as a link for further information and materials. Thank you.
Thank you, and thanks to all of today's speakers for your informative presentations. Next slide, please. Links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2021/november.html. We have time for a few questions, so please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. Our first question is for Dr. Connors. What role are livestock thought to play in the transmission of Giardia?
Thanks. So I think we're still trying to understand the role that livestock play in the transmission of Giardia, especially as we use molecular techniques. We do know that the same assemblage that's found in humans can be found in livestock. However, based on the outbreak data from 2012 to 2017, we didn't see any associated outbreaks with livestock. And then, as I mentioned, in 2008, there was one among cattle, but that wasn't something that I had looked at specifically. You may also want to check resources available from the National Association of State Public Health Veterinarians that may also have more information about enteric diseases linked to livestock.
Thank you. And another one for you, Dr. Connors, just a question asking if there are any resources available on testing private well water for Giardia that you could suggest?
Yes, so typically what we suggest is to contact the state certification officer for a list of labs that can perform tests on drinking water, typically for a fee. And so Giardia can get into the water in different ways, including sewage overflows, sewage systems that aren't working properly, polluted stormwater runoff, or other runoff water. And so the well may be vulnerable to all these different contamination sources. So really, we recommend either going to the state certification officer for laboratory or a well water systems professional who can guide the homeowner about local contaminants in addition to Giardia, and then how to appropriately test for their situation.
Great, thank you so much. Our next question is for Carrie Krug. Were these interviews from residents in one specific state, a particular region, or all over the country?
Yeah, these interviewees were from all over the country. So participants were recruited through a professional recruiting agency that draws from its own existing database of individuals interested in research participation who have voluntarily signed up to participate. So unfortunately, no information on geographic location gathered.
Thank you. And another question for you. How was owner attachment to pets measured?
Yeah, so everything that we gathered could be considered qualitative information, and everything was self-reported. So again, nothing here was exactly quantified apart from the demographic information, but again, moving into some more quantitative analysis or data collection on this issue would definitely be a great next step here. Thank you.
Our next question is for Drs. Hamer and Roundy. Did the fly traps have any attractants other than color? This person is wondering if the differences in attractiveness to the various taxa were due to attractants or just design.
Yeah, we did not use any additional attractants on the sticky traps. There was a difference in color, the easy traps that performed the best being bright yellow and the others being gold, and a patterned trap that had blues and greens, if I remember. For the liquid traps, we used about a quarter of the recommended bait in those traps since they were only being used short term.
Thank you. And another question for Carrie. Did you collect data on what options owners were given prior to obtaining antibiotic prescriptions to understand if there were differences in veterinary practices in your sample?
That was not part of this particular round of interviews, but again, great suggestion and something that we could include in future work.
And a couple more questions for you, Carrie. How many owners were interviewed?
Yes, so there were 6 owners interviewed and 8 dog breeders interviewed.
And how did you define breeder?
Oh yeah, so there was a range of breeders interviewed. As I mentioned earlier, some were USDA licensed breeders, some were small scale or just hobby breeders. So again, just drawn from this network of research participants, voluntary participation, and that they were self-reported breeders.
Thank you. And another question for Drs. Hamer and Roundy. Can you elaborate a bit about the wastewater surveillance for SARS-CoV-2?
Yeah, sure. This is Gabe. So certainly early on in the pandemic, a lot of communities around the world started realizing that they could tap into wastewater systems coming out of, homes or communities and recover viral RNA. And so through quantitative PCR, they were able to detect the presence of the virus coming out of these, groups of homes. And so then that started to be used by communities throughout the U.S. I know even at Texas A&M University and some other universities for many months, they were using that as a tool to track where on campus transmission was occurring. So that's about the extent of my knowledge.
Thank you. And one question for Dr. Connors, is there a big difference between the number of giardiasis cases and outbreaks, i.e. single cases not linked to other cases versus linked cases?
Yeah, thanks for that question. I don't know off the top of my head the size of the difference. Online, there are available the surveillance reports. There's two separate surveillance systems, as I mentioned. So the National Notifiable Diseases Surveillance System does report by year and has the number of outbreak-associated cases, and that's separated by region and jurisdiction. But I haven't made that direct comparison between what's reported there recently versus what we see in the NORS system.
Thank you. And then one more question for Carrie. Would you consider interviewing veterinarians in your study continuation?
Yeah, I think that's a great idea. I think these interviews raised more questions than they answered. And one major issue highlighted here among the conversations with dog breeders is that concept of breeder-centric vets that cater to the needs of breeders and are, in some cases, facilitating improper use of antibiotics. We at CDC have been working with our federal partners to promote veterinary antibiotic stewardship. But I think next steps here could include, further engaging with professional organizations, for example, the American Veterinary Medical Association, to highlight this issue and discuss stewardship among those vets specifically working with dog breeders. And it's possible that may include some interviews. Thank you.
Thank you. That looks like all of the questions that we had. So if you have other questions for today's presenters, we've included their email addresses on this slide on the ZOHU call webpage for today's webinar and in today's email newsletter. A video of today's webinar will be posted within 30 days. Next slide. Please join us for the next ZOHU call on December 1st. And thank you for your participation. This ends today's webinar.